My name is Sophie Ellis-Bextor and I'm a singer, but I'm also a mother of 4. So every aspect of childcare really and health for expectant mothers is something that resonates with me. My first 2 babies were born prematurely and I was very, very lucky to be having them in a place where in the Western world we've access to such incredible medical technology and support and incredible doctors and nurses and midwives. I suppose it never really occurred to me to think, would they survive? Would I survive? It was more a case of adapting to the procedures that my premature babies would need to help them get strong and healthy enough so that they could come home. And it was really in the aftermath of my first babies being born that way that led me to do a little bit of investigating, really, and to think a little bit about what it's like for other mothers and healthcare professionals around the world. So when I heard about medical aid films and the films that they were making specifically to help train midwives and to help reduce maternal death and complications from pregnancy, it really resonated with me because I was by that point aware that for some people, even getting to a hospital, even finding those doctors and nurses is not a given. They might have to walk for days to find their birthing centre. When they get there, something as simple as preeclampsia that I had, there might not be someone there that can easily take their blood pressure. There might not be someone there that can recognise the symptoms of preeclampsia, stuff that I completely took for granted. Medical aid films make these incredible animations that have gone to over 145 countries around the world, been translated into over 20 languages. They are a really effective way of teaching because you haven't just got the information of what you're hearing and the information that's being written on the screen, but you've got the practical. So it's literally able to train up midwives. This can prevent maternal death. This can prevent issues happening to babies like mine. And I'm such a big fan of really simple, technologically forward, global incentives that can help spread information, that can help educate. Some of the medical aid films are something as simple as how children can wash their hands effectively to stop spread of infection and disease. Keeping yourself hygienic, keeping yourself aware, keeping yourself prepared for life, staying safe, being healthy. These things aren't actually a luxury, but sometimes getting access to the information is. And we are now living in a time where the resources mean that people can watch videos, they can share information. This is the way the world works, and it's using all that technology and all those connections to really spread the word. And it shouldn't be a luxury to expect to be supported and looked after when you're having a baby. It shouldn't be a luxury for someone who has dreams of becoming a midwife to get access to the information that mean they can do that successfully. These are just positive, powerful steps. So I really hope everybody gets behind the medical aid films because it's not even a big commitment. It's only cost as little as £43 for a midwife to receive the training. These are things we can all do so that everybody like me can get a little bit closer to maybe not taking for granted, but definitely having access to everything they need. So I'm very happy to support medical aid films, and I hope you are too.